here today to talk about how you can impact the cost of your healthcare costs. The rising cost of healthcare has become a major topic of conversation, and with good reason. Healthcare costs have been increasing for decades with no apparent end in sight. In the 10-year time span from 2008 to 2018, the average family premiums have increased 55%. That's twice as fast as workers' earnings at 26% and 3 times as fast as inflation. Deductibles have also increased. There are many different opinions on how exactly to decrease costs and even more debate as to the cause behind them. What is the reasoning behind the drastic increases? While that question may have many answers, one of the most impactful is the effect of chronic conditions, which require constant care from medical professionals. Chronic conditions are those conditions that come upon us slowly and develop and increase over time. Some examples would be cardiovascular disease, including hypertension, diabetes, even obesity, as well as cancer and many of the autoimmune diseases. Arthritis is a great example of an autoimmune disease. Chronic conditions range in severity and attention needed to manage them, which can dramatically affect the healthcare costs associated with both chronic illness and mental health. Healthcare costs for people with a chronic condition average $6,032 annually. That's 5 times higher than for those without such a condition. While today's situation is grave, the chronic disease crisis looms even larger tomorrow. By 2025, chronic diseases will affect an estimated 164 million Americans, nearly half of the population. How does the prevalence of chronic conditions affect our health care costs? The financial ramifications are far-reaching. Not only will chronic conditions cost you, the patient, more in prescription costs and out-of-pocket expenses, but they tend to drive the overall healthcare premiums upward as well for both the employer and the employee. The more chronic conditions a person has, the more likely they are to require and use medical services. The 2017 RAND study states that those with 5 or more chronic conditions use twice as many prescription drugs on average per year compared with those with 3 or 4 conditions. In addition, those with 5 or more chronic conditions saw the doctor an average of 8 additional times throughout the year than those with only 3 or 4. The good news, chronic illness can be drastically reduced by 4 key behaviors: tobacco, diet, exercise, and alcohol consumption. Up to 80% of chronic disease can be delayed or eliminated by changing your behaviors. Here you can see the association between the behaviors and chronic illnesses. Exercise impacts nearly each of the chronic diseases, as does your diet. You can see that tobacco also impacts many of the diseases, as does alcohol consumption. Research shows that you can reduce your risk of diabetes alone by 58% by participating in the Prevent T2 Lifestyle Change program. This program focuses on diet and exercise. The annual cost of diabetes is $13,700. In addition, hypertension, a cardiovascular disease, costs as much as $733 per year, and the overall cardiovascular diseases rise as high as $6,060 per year. Additional autoimmune diseases such as arthritis cost an average of $2,000 per year. I know this is a lot of numbers, but all those numbers ranging from even $700 to $13,000 impact your pool of claims and increase the average dramatically. Unfortunately, these expenses hit both the employer and the employee through insurance premiums and out-of-pocket expenses. We can do something about our health, and the bonus will be an improved quality of life. You can see that addressing the behaviors, the root cause, can drastically reduce your risk of multiple conditions. In addition, the longer chronic conditions go undiagnosed, the more expensive they may be to manage. More common and simple chronic conditions may require simple prescription drugs, but diseases like cancer are far less expensive to treat when you diagnose them earlier. And certainly, you want to catch them at stage 1 versus that stage 4. Remembering that group healthcare prices are determined in large part by the population's previous claims, all of this equates to higher healthcare costs for the entire group, not just you, the individual. We encourage you to not only do your preventive screenings, but take charge of your health behaviors. Of course, we understand that having the knowledge about chronic illness and behaviors that are associated with them is easier said than done. We're here to help. Let's let Bethany talk about obesity and how you can make some simple changes to address the overall obesity crisis that our nation is facing.
Obesity is one of the biggest drivers of preventable chronic diseases and healthcare costs in the United States. Currently, estimates for these costs range from $147 billion to nearly $210 billion per year. Kentucky's adult obesity rate is 34.3 compared to 30.1 in the nation. Worse yet, the percentage of our population that is overweight in the U.S. is 71.6. Small changes can make a huge impact. Things you can do now: increase water intake while reducing sweetened drinks, including artificial sweeteners. This may be as simple as keeping a water bottle with you and consuming one in the morning, the afternoon, and the evening. Eating whole foods. At the end of the day, choosing whole foods is not only less expensive, you will feel and see a dramatic difference in your health. We understand everyone is busy and it is not always easy to choose the best option, but you can make better choices most of the time and best choices some of the time. Eating whole foods greatly reduces your intake of fat and sugar, dramatically reducing your risk of chronic illnesses and of course your weight. Making half your meal fruits and vegetables. Let us help you develop strategies to access and choose vegetables even on a budget. Move. You do not need a dramatic exercise program to change your activity habits. Just 10 minutes of structured exercise at a time can greatly improve your health. Focusing on a combination of exercise and physical activity by monitoring steps has been a proven way to lose weight. Exercise can be done at home, the park with your kids, the office with friends. It is often a mindset change. And lastly, mindfulness. Stress management and being mindful of everyday behaviors can change your mindset. If you need a little bit more motivation, your wellness program at work is a great place to start, and grab a friend to join you.